Joe Rogan takes BPC-157 and he loves it. So do millions of biohackers, athletes, and people desperate to heal injuries that nothing else is fixed. But should you take it? And more importantly, how should you take it to actually get good results? What I'm about to share with you comes from my clinical observations, and there's millions of use cases of peptides across the country. And yes, they're not FDA approved, but the reality is peptides are the way with the future. And if you want to heal from injuries, you need to listen to this. If you're new to my channel, hi, I'm Dr. Jones DC, and I coach thousands of patients through our nationwide clinics, and healing peptides have been a cornerstone of our practice for injury recovery and just getting you back to play. Me personally, I couldn't play volleyball for 18 months until these peptides changed everything. Now I work with my medical team helping patients achieve the same breakthroughs. Look, I've seen these peptides help patients avoid surgery, recover from injuries that doctors said they would never heal, and got back to doing things that they love. But I've also seen people inject thousands of dollars of fake contaminated products with zero results. Whether you're already using healing peptides and wondering why they're not working, or you're considering them for a nagging injury that won't go away, this video covers everything: the science, the risks, the exact protocols we use, and more importantly, how to make sure that you don't waste your money on garbage that doesn't work. And here's something crucial. If your body can't process energy properly, what we call metabolic dysfunction, these peptides can have dramatically reduced effectiveness. So I'll show you exactly why, and more importantly, what you can do about that. Okay, so let's get started with what makes these peptides so special compared to everything that you've tried. So what exactly are BPC-157 and TB500, and why are they creating such a revolution in healing? BPC-157 stands for Body Protection Compound. Your stomach actually produces a version of this to protect and heal your gut lining from acid. When we isolate and inject it, we're sending that healing signal throughout your entire body, not just at one spot, but everywhere. See, at a cellular level, BPC-157 triggers your body to grow new blood vessels, what scientists actually call angiogenesis. Think of it like building new highways to deliver healing supplies to injured areas. Your injury is a construction site that needs materials, and BPC-157 literally builds the roads to get them there faster. Research shows that BPC-157 influences growth factor pathways in fascinating ways. Animal studies demonstrate that it enhances the body's natural healing signals through multiple mechanisms that we're still unraveling. Think of it like optimizing your body's repair network, making everything communicate better. Now, TB500, that one's completely different. While BPC-157 builds the infrastructure, TB500 helps your repair cells get there faster. It's like giving them a GPS signal in a fast car. Using both peptides together just makes sense because they work in completely different pathways. Now, we don't have studies comparing one versus the other, but since they do different things in the body, using them together should theoretically give you better results. And we can back that up in our clinic. I've seen dramatic enhancements when we add to BPC-157, TB500. Now, the key difference from these peptides versus non-steroidal anti-inflammatory drugs or cortisone injections, those suppress your healing response, but these peptides actually work with your body's natural healing processes, enhancing specific pathways like blood vessel growth and cell movement. Now, quality means everything, and I want you to understand this. We work with 503A compounding pharmacies. They follow strict standards and get regular inspections, but research chemicals, those are the things that you get online without a prescription, no doctor intervention, and they say not for human consumption. Those have documented contamination risks. Stick with pharmacy grade. Again, 503A or 503B. These are legitimate medical facilities, state board oversight, and FDA regulated framework. They follow strict guideline standards, and they undergo regular inspections. Now, I'm not trying to scare you. I'm just trying to save you from wasting thousands of dollars on fake products. Quality matters more with peptides than almost any other intervention. See, here's what most people don't understand. Peptides aren't like taking ibuprofen. They're signaling molecules that tell your body to activate specific healing pathways. But if those pathways are broken, or if you're just using fake products, then nothing will happen. So many people throw money down the drain utilizing research chemical options. And look, I get it. I respect everybody taking matters into their own hands. I've just seen so many people come to us frustrated thinking peptides don't work, and they get on some real stuff and night and day difference. But here's the thing. Even with quality peptides, some people get miraculous results, while others, nothing. It took us years of figuring this out, trial and error with patients. I mean, I've seen patients spend $10,000 on stem cell treatments with zero improvements and then get complete healing from $500 worth of peptides. But then I've also seen the opposite, peptides failing when everything else worked. What makes the difference between miraculous success and total failure? The patient that I'm about to tell you about discovered the answer the hard way, and her story changes how our clinic and our doctors approach every single peptide case. Jennifer, 47, competitive tennis player, complete rotator cuff tear. That's when the tendon in your shoulder is torn all the way through. Orthopedics told her, hey, surgery is the only option. She tried everything. Physical therapy for years, PRP injections, stem cells, nothing. We started her on BPC-157 and TB500, BPC at 500 micrograms, daily subcutaneous injection. That means underneath the skin into the fat tissue. TB500 at 1,000 micrograms a day, plus 30 grams of collagen peptides. She'd continued her physical therapy. Week 3, she calls with significant improvements. Pain dropped by 70%. First time that she felt real hope in years. Week 8, full range of motion is back. Week 16, she was competing again. But here's what matters most. We addressed everything. The peptides were the catalyst, but I think it was our comprehensive approach that really sealed the deal. Now our patient Mark shows why you sometimes need both peptides. 52 years old, marathoner, chronic tendon damage in both Achilles, what doctors call bilateral tendinopathy, told to stop running forever. Started just BPC-157, minimal improvement. We added TB500 at a large dose, 2,000 micrograms daily. For this severe case, by week 6, he was doing light jogging. A couple months later, he was running a marathon. Not at his fastest, but it was remarkable considering he was told he'd never run again. The TB500's cell migration properties made the difference. His tendons were so damaged that BPC-157 alone couldn't mobilize the repair cells. My own story, 18 months without volleyball, shoulder pinching, what they call impingement syndrome. I had jumper knees in both of my knees. Finally went all in on the Wolverine protocol. Same thing we just talked about, 500 micrograms daily of BPC and 2,000 micrograms daily of TB500, plus we did CJC ipamorelin. Week 10, I was back on the court playing competitively again. The combination approach seems to accelerate recovery beyond what either peptide can do alone, and it makes sense when you look at the mechanisms. If you just realized why your injury hasn't healed after months of trying everything else, do yourself a favor and hit that subscribe button, because we're releasing 2 videos every single week exposing peptides and the various protocols that actually work when nothing else does. We had another patient, post-surgical ACL recovery, 28-year-old athlete. Standard recovery timelines was 9 to 12 months. With our peptide protocol, we had them back in 3 months post-surgery, cleared to return for sports, 5 months in, half the time. But why don't these work for everybody? Why do some patients inject thousands of dollars with 0 results? The answer is completely changed how we approach healing. You might have seen videos out there saying that you should never take BPC-157 because of cancer risks. Let me address this head on with actual clinical experience. But wait, what if you've had cancer risks in your family? Should you even consider these peptides? What does 10 years of clinical data actually show versus what fearmongers online that don't know what the hell they're talking about like to claim? The answer completely contradicts what you've been told. So I just want to state, in our 10 years of treating thousands of patients with peptides, let's talk about the elephant in the room here. Yes, the cancer risks. BPC-157 does promote blood vessel growth, angiogenesis. Theoretical concerns could feed tumors. But here's what fearmongers aren't telling you. Context matters. We're talking about short-term, 3 to 4 month maximum cycles without a break. You properly cycle these. You don't run them continuously for life. In our practice, and we've done this over 10 years, we haven't seen any cancer cases that we could probably link peptide use to. Now, that's just our clinical experience. It's not the same as a controlled study, I want to be clear. Now compare that to the confirmed risks of chronic inflammation from untreated injuries. Chronic inflammation is a known cancer promoter. So which risk is greater, theoretical from peptides or confirmed from inflammation? Not to mention, when you can't do the things that you love, we know what detrimental impact that's going to have to your life. Our safety protocol, we still won't treat anybody with active cancer or a history of cancer. We'll need to go see an oncologist for clearance. And again, we like to cycle 3 to 4 months on, 1 to 2 months off. This conservative approach allows for assessment periods. Get your cancer screening first, colonoscopy, mammogram, PSA, skin checks. Be smart about this, but don't let theoretical risks keep you from addressing real current suffering. Who probably shouldn't use these? Pregnant women, patients with active cancer, children unless a specialist prescribes and approves, active infections. People fear peptides, and it's crazy because there's years of research, extensive research, not as much human research as we would like. There's a whole nother conversation, but a ton of animal data. So what do people end up doing? They rely on things like non-steroidal anti-inflammatory that destroy your gut cortisol. Yeah, we have more research on how they're quote unquote safe, but meanwhile, they're killing you slowly and surely. And I mean that by increasing gut inflammation, contributing to chronic inflammation over time. Sure, one occasional use case, not a big deal, but over time, this stuff adds up. Cortisone shots, by the way, literally deteriorate the cartilage in your joints. Other side effects of cortisone injections: weight gain, bone loss, immune system suppression, tissue breakdown. That's real risk. Contaminated products from research chemical companies, that's another concern. I think people assume all peptides have this sort of risk, but that's research chemicals, not 503A high quality peptides. Now here's the plot twist that shocked me big time. Your metabolism might be sabotaging every peptide you inject, making them completely useless. What our doctors discovered treating pre-diabetic patients completely transformed how our entire approach goes. So our clinic has probably treated a total of 3,000 patients, and discovering your metabolic health determines a big piece of how you're gonna respond. A significant portion of Americans have metabolic dysfunction. That's when your body can't process energy properly. That means chronic inflammation, poor circulation, cells that won't respond to signals. When you have insulin resistance, that's when your cells stop listening to insulin, the hormone that controls blood sugar and fat storage. Your cells become deaf to all signals, including peptide signals. Like trying to have a conversation in a nightclub. It just doesn't happen. By the way, what's your metabolic health score on a scale of 1 through 10? Drop it in the comments. Have you even had it checked, aka fasting insulin C-peptide test? One of our patients, Sarah, came in for tennis elbow. 6 months of everything, included peptides elsewhere, nothing worked. Her labs, she was pre-diabetic. Massive inflammation shown by labs that we checked called CRP, and that's what checks inflammation. So we addressed it all. BPC-157 for the elbow, tiny doses of GLP-1s for insulin resistance. We optimized her thyroid, we fixed her sleep. Within weeks, her inflammatory markers dropped significantly. BPC-157 that wasn't working suddenly started showing results. 8 weeks, complete resolution. This is our specialty, combining metabolic optimization with healing peptides. GLP-1s like semaglutide aren't just for weight loss. Research shows that they have powerful anti-inflammatory properties as well that may support the healing process. So think about it like this: GLP-1s prepare the soil, peptides plant the seeds, and bad soil equals no growth. One of our patients, John, shoulder injury, 6 months, BPC-157 from another clinic, 0 improvement. Labs showed pre-diabetes, sky-high inflammation. So we microdosed GLP-1. 3 weeks later, the shoulder started responding. 8 weeks, he was completely healed. Cost $150 to $300 monthly for GLP-1 therapy, but if it doubles your healing time and avoids expensive surgery down the line, you're saving a countless pile of money. Some patients need both metabolic support and peptide support. Some people just need peptides. That's why personalization in medicine matters significantly. You don't want to be just injecting whatever the hell you think makes sense or what some dude on TikTok says. Here's the controversial question: peptides alone or peptides plus metabolic support? What's your take? Drop it in the comments below. So how exactly do you dose these peptides? What's the difference between acute and chronic injury protocols? Why do some people need double doses while others get results from tiny amounts? Let me show you the exact protocol matrix that we've refined through thousands of treatments. So after 10 years of seeing what works and what doesn't, and remember, there's no official human dosing in the research yet, here's what our practitioners have found effective. Screenshot this, but work with your provider to customize it for you. So we got acute injuries, less than 2 weeks old. Start out aggressive, BPC-157, 500 micrograms daily, plus TB500. You can work up to 2,000 micrograms daily. Your body's already in healing mode, you can amplify it. Chronic injuries over 6 months, different approach. Start with TB500 alone at 2,000 micrograms for 2 weeks, then add BPC-157 at 205 micrograms and increase to 500 after 2 weeks. Why? Chronic injuries need cell migration first. Post-surgical protocol, weeks 1 through 2, BPC-157 only at 250 micrograms, gentle start, week 3 onward, add TB500 at 1,000 micrograms and increase as tolerated. Multiple injuries or severe cases, Wolverine protocol, BPC-157 at 500 micrograms daily plus TB500 2,000 mics daily. Add CJC-1295 and ipamorelin at night for growth hormone support. Failed previous peptide cycles, check your metabolic health, then double your dose. BPC-157 750 micrograms a day, TB500 up to 2,000, but only after ruling out quality issues. Let's talk injection technique. Rotate your injection sites, belly, thighs, arms. You don't need to inject near the injury. Systemic effect, not local. Specific injury protocols, rotator cuff, standard BPC TB combo, tennis or golfer's elbow, BPC first, then add TB if needed. Achilles injuries must have high dose TB500. Low back or disc issues, you can even look at thymosin alpha 1 for inflammation. When it comes to timing, this doesn't matter as much. You take your peptides in the morning, empty stomach or with food, it's completely fine, but make sure your growth hormone peptides are taken before bed on an empty stomach. Now, if you made it this far into the video, 20 minutes in, what surprised you the most about these dosing protocols? Share below, it helps us know what we need to clarify. Now, when it comes to cycling, we recommend that you take a conservative approach, 3 to 4 months on, 1 to 2 months off. This allows your body time to resensitize to the peptides, because there is a critical decrease in effectiveness if you just use them chronically. Very important when it comes to storage. If your peptides are reconstituted, meaning they're added to the bacteriostatic water and they're in solution, ready to go, you gotta keep that stuff cold and you wanna keep it out of light. 30 to 45 days, but if you see cloudiness in the bottle, toss it, don't inject it. Patients that are using research chemicals really need to pay attention for this in order to stay safe. Now, here's what we typically see, but remember, even with perfect treatment, complete tears need 3 to 6 months. Week 2 to 3, you may feel less pain. Week 4 to 6, healing might speed up. Week 8 to 12, most see real improvement. Chronic stuff, usually more in that 3 to 4 month range. Now, let's talk lifestyle factors, because these can double or even triple your results. Or if you don't do the lifestyle, you might just completely be wasting your money. The difference between success and failure isn't what you think. In fact, the #1 factor behind successful peptide results might actually shock you. So what I've learned from the patients who get miraculous results versus those who fail, if you're spending thousands on peptides, but you're ignoring these factors, you're flushing money down the toilet. Sleep is your #1 healing amplifier. Your body releases growth hormone naturally during sleep cycles. BPC-157 increases growth hormone receptors. No sleep or crappy sleep equals wasted peptides. You should be sleeping about 7 to 9 hours minimum. If you want to improve your sleep quality, you've got to increase your temperature around the environment, say around 65 to 68 degrees, and sleep on a bedtime schedule. Have a schedule for when you go to bed and when you wake up. Blackout curtains, block as much light as you possibly can. Increase your intake of magnesium. I like about 300 grams of magnesium 3 and 8 before bed. Now, before bed, have a sleep time schedule. Set an alarm on your phone for about 2 hours before bed, before that bedtime that you think you can commit to, and that'll prompt you to start relaxing and get ready for a good night's sleep. Add collagen supplementation, about 15 to 30 grams every single day. You need collagen peptides. Regular protein has amino acids, but collagen, there's research to show that it does support the healing of these musculoskeletal injuries even better. Try to find a good collagen supplement that has vitamin C added to as well, or just add a little extra vitamin C yourself, about 500 milligrams. Supplement-wise, to increase the anti-inflammatory effect, take your curcumin about 2 to 3 grams a day. When it comes to curcumin, you can increase the dose slowly, starting with 500, working up to 2 to 3 grams. If you notice that your stools get a little bit loose, you can back off the dose a little bit. That's your therapeutic dose, as much as you can tolerate, up to 2 to 3 grams a day. Talk about pharmaceutical grade anti-inflammatory effect. I mean, when we high dose patients on curcumin with resveratrol, the results are freaking amazing. Make sure you add about 2 grams of high quality fish oil with a good amount of EPA and DHA as well. Now, I can't stress this enough. Movement matters. If you're gonna make investments in healing peptides and you're not doing physical therapy and or chiropractic, like, that's just crazy to me, because you're already investing so much money. Find a good PT and or a good chiropractor. Sometimes the chiros can do PT and sometimes the PTs can do a little chiro. Find at least one of these experts that work with your body, that can find movement dysfunction and patterns, tight muscles, weak muscles, and help fix the balances in your body, and the chiropractor can help work on the alignment. Putting these basics in are going to put your body into a better position where healing will speed up. Trust me, I've seen this time and time again. Don't forget, stress will destroy your healing. High levels of stress means high levels of cortisol, the stress hormone, which directly opposes tissue repair. The injury itself is a stressor. Adding things like adaptogenic herbs, breath work, these will decrease your stress, decrease your cortisol, and prompt your body for better healing. Foam rolling and lacrosse ball work at home, 10 minutes daily on the affected areas, breaks up the adhesions, improves the movement around the areas. Any of the muscles around joint pains, if you can break up those muscle adhesions, are gonna improve motion, which can improve blood flow and likely improve healing too as well. And if you have access to red light therapy, about 10 to 15 minutes a couple times a week, can improve the function of your mitochondria, which can improve the healing in your cells. If you got some really nagging injuries, find a clinic locally that does PRP injections if the budget allows. Avoid things that block your healing. Alcohol will slow down healing. Non-steroidal anti-inflammatory drugs, they will mask your pain, but they will impair healing. High levels of sugar creates inflammation, and smoking destroys circulation. When it comes to nutrition, focus on an anti-inflammatory diet. The most powerful anti-inflammatory diet, hands down, is a carnivore diet. But if you don't want to go that strict, just cut out processed foods, increase omega-3 rich foods, colorful vegetables, quality proteins. You're building tissue. You need the raw materials. Stay hydrated. I can't stress this enough. Your body, drink half your body weight in ounces of water and add electrolytes, especially if you're doing some sort of fasting protocols. One more thing I gotta say, have some patience. Real healing takes time. We're so conditioned to get instant relief from painkillers that we forget tissue repair takes weeks to months. Trust the process, put in the work along your healing peptides, and watch the results come over time. But why do some people still fail even when they do everything right? The hidden sabotage that nobody talks about after seeing the same failures repeatedly over and over, I think we finally figured out what that is. I think the biggest sabotage when it comes to people healing with peptides, and it breaks my heart because I see so many people waste so much money on mistakes that are completely preventable. Number one, it's using research chemicals. 60% of online peptides are fake or contaminated. You're injecting mystery powder from China. Get high quality peptides from a 503A compounding pharmacy. Quality matters. Number two, storage mistakes. Heat destroys peptides. You leave it in the car, dead. You store it incorrectly, dead. That $500 vial is now saline. Make sure you protect these peptides, keep them cold, keep them stored in the fridge. Number three, giving up too early. Like week number two, number three, it's not working. Tissue repair takes time. You didn't tear that tendon in 2 weeks. Maybe you did, but for the chronic injuries, it took time. Same thing on the other side of the spectrum, it takes time to heal. If you're not increasing your intake of collagen and vitamin C and you're getting terrible sleep and high stress, you're not putting your body into a primed environment, you're not doing the lifestyle, then you might not get results. So put in the work, this is an investment. Remember, these peptides aren't magic. If you have a complete tear and you need surgery, peptides aren't gonna replace that, but peptides can certainly enhance the injury, reduce inflammation, make for a better surgery before, and add for a better recovery afterwards. Our most successful patients, they address everything. They use quality products, they stick with it, they stick to a protocol, and they treat their body well. Now, speaking of success versus theory, let me address the last thing here and this controversial thing head on. You might have seen videos saying, never take BPC-157, it'll give you cancer, it's dangerous, but we talked a little bit about this earlier, and I just gotta hammer this again. We've never seen it happen. And if you have active cancer, then it's probably a good idea to just play it safe. But outside of that, you deserve to heal, and don't let some fear mongers that don't understand how this stuff works tell you otherwise. The last thing I want to share with you guys is if you're looking for high quality peptides, you want to work with a clinic. We do service all 50 states. You want to work with somebody who's actually going to guide you and put together a protocol for you. I'll drop a link in the description where you can book a free discovery call with our experts and figure out how peptides can be incorporated into an overall health optimization journey. Other than that, guys, if you're curious about that metabolic dysfunction that we talked about, check out this video here. This is the 10 common mistakes that people make on their GLP-1 weight loss journey. Optimizing your health is going to enhance your peptides. We'll see you guys later.